The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello, everyone. Welcome back to another episode of the Dental Download podcast. This week, we are joined with a guest. Her name is Dr. Porchia, and she is an oral and maxillofacial surgeon at a practice called About Face. I'm definitely looking forward to sharing her story with you all through the rest of this episode, but before we get into that, I did just want to do a quick recap, as usual, about what's going on in my life in dental school. If you're new here, my name is Haley, and I'm the host of this podcast. I'm a second-year dental student now at University of Michigan School of Dentistry. And lately, we've just kind of been settling in about halfway through now our summer term. So we started at the beginning of May. So some of our classes run through half the semester, and then we're starting a new set of classes. So we've been having some finals for those classes that are finishing up. And then in the coming weeks, we're going to start some different systems classes, as well as starting up biomaterials again. I think I mentioned in an intro that I did pretty poorly on our respiratory system class for the first exam, but I did really well and got a high A on our final, and was able to bring my grade up a whole letter. So that was very exciting, and it was nice to see that hard work kind of pay off. I did some assisting this past week, and I also had our perio boot camp. And after that, we're officially allowed to be doing cleanings on patients. Given the really tight clinic capacity right now, and patients are booking out like weeks in advance, which is maybe normal for private practice, but for the dental school clinic, usually you can get an appointment the next week, but now it's like 3 or 4 weeks in advance because they're renovating our dental school, so 2 of our 4 clinics are closed. But really that means that we are not going to be doing cleanings on patients this summer semester like we usually would, hopefully in the fall, but most likely in the winter of our D2 year, and hopefully we'll actually get to start doing some other procedures on patients by then as well. But we are approved to be doing comprehensive exams for new patient exams or for recall exams, as well as cleaning. So that's really exciting. And the last thing I want to mention that happened this past week is an external rotation for my mini rotations class that I'm in through the selectives pathway as part of the Pathways program at my school. Kind of a mouthful, but basically we would usually be doing rotations through the specialty clinics at my dental school, but because of COVID, the specialty clinics weren't really keen on having extra students in there on top of the D3s and D4s doing their rotations and managing their actual residents and making sure that they're having a good clinical experience. So they designed some external rotations for us outside of the dental school. One is going to be at a lab, like a prosthetics lab where they make dentures, bridges, and crowns. And then the one that I did last week was a four-handed dentistry lab. So we did a lecture about assisting. We learned about some good stretches to do to help with your posture and your strengthening and stretching, of course. And once the lecture was done, we got to go into their simulation clinics and work on their little type-it-on heads and do a restoration, a prep and restoration. And the main point was four-handed dentistry was the theme of this external rotation, as well as focusing on ergonomics a lot. So we learned a lot about assisting, what to look for in an assistant, what an assistant is able to do state by state. Specifically, we focused on our state of Michigan, of course, but it was a really, really awesome experience, and it was just great to be back in a classroom setting and back being lectured to in person, and I really hope that we'll go back to in-person lectures starting in the fall, but we don't have word on that yet. I will definitely be updating you all in future intros as I know more about our upcoming schedules for the fall semester. But with all of that being said, let's get into the bulk of this episode, our discussion with Dr. Porchia about her experience in oral surgery and her advice to our listeners. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. did I mention it is totally free, no catch? I've been using Spotify for podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. All right. Hi, everyone. So we do have another guest here today, and I'm just going to let them introduce themselves a little bit.
Hi, everyone. I am Dr. Porchia James. I'm an oral and maxillofacial surgeon. I'm based in Frisco, Texas, which is a suburb north of Dallas. I practice full scope oral and maxillofacial surgery. My office is about face, oral and facial surgery. And, like I said, that's our private practice. We do full scope, oral surgery, wisdom teeth, extractions, dental implants, full mouth reconstructions, trauma, pathology, sedations. We do a lot. We do a lot at our office. But a little bit about me. I graduated from undergrad at Xavier University of Louisiana, which is in New Orleans. I then went on to dental school at Meharry Medical College in Nashville. My path to OMFS was a little bit different. After I graduated from dental school, I went on into the military, went to the Air Force Dental Corps. So I was a captain in the Air Force as a general dentist at the time. I did an AEGD. While I was in the Air Force, I did my AEGD at Keesler Air Force Base in Mississippi. I went on for 2 years. I went overseas to the UK. I was at RAF Lakenheath, UK. That's where, I did I had a different kind of situation there. So if you don't know anything about the military, you're stationed at certain bases. You don't really get to decide where you're going to go. So I was stationed there in that particular base. They were generally slated for 2 oral surgeons there. However, at the time, there was a shortage of oral surgeons. So they only had one that was there. So they knew that I had an interest in oral surgery. So I was actually able to kind of adjust my schedule to where, 2 days out of the week, I would do just strictly oral surgery procedures. And I was actually able to go to the operating room. On Mondays, we would go to the operating room with the oral surgeon that was there. So I learned how to do orthodontic procedures or orthodontic surgeries there in trauma and things like that, which is a pretty unique experience for a general dentist, especially a general dentist that, had not done even an oral surgery fellowship prior to. So that kind of afforded me the opportunity for a lot of things. First of all, experience. And then I think, that was pretty much a great aspect about my resume or my CV that allowed me to go or to gain acceptance into oral and maxillofacial surgery residency. So after that, after I left England, I was stationed stateside back in South Carolina. I was at Sumter Air Force Base. And that's when I applied for oral surgery residency. I got accepted I went back to Meharry Medical College for my residency. And so I finished residency in 2016, and I stayed on for a year, and I taught the residents and the dental students as an attending before we decided to move back to Texas, which is where I'm from. I'm from Dallas. So we moved back to Dallas in 2017. I typically don't do things ideally. So when we moved, I was about 4 or 5 months pregnant. I think I was 5 months pregnant actually when we moved here, because the whole point of moving here was to start a private practice. So 5 months pregnant, renovated the place for where our practice is going to be. When we opened the practice, or when we finally opened the doors, I just had my baby. My baby was 5 weeks old when I started interviewing for dental assistants and our office staff. So I don't know if that makes me crazy or courageous, but we made it happen thanks to, to help a family and my husband. So, yeah, so I've worked corporate. I've worked the corporate sector, part-time, even during my startup phase. And when I was at Meharry, I worked corporate part-time as well. So I can tell you about private practice. I can tell you about the corporate side. I can tell you about military. So, yeah, that's a little bit about me in a nutshell.
Awesome. I do have some follow-up questions, I guess, starting with your Air Force experience.
Uh-huh.
So, were you enlisting in the Air Force as a part of the scholarship program? Is that your involvement?
Kind of, sort of.
Okay.
So I actually did ROTC in undergrad. So at the time when I did my ROTC, I was actually supposed to go ahead and get commissioned before I went to dental school, but I had gotten accepted into dental school. So for me, I ended up doing what's called an educational delay. So that I can go to dental school and then serve my active duty time. So no, I actually didn't do the HBSP program that you're referring to because they had paid for my undergrad. If I would have accepted, HBSP in addition to the previous payment for my scholarship for ROTC, I would have owed them 8 years. So I'd already owed them 4 from undergrad. And so at the time, because I didn't really know, what the future would have held for me, I just decided against the HBSP. But that is a great program to utilize because you get a stipend, you get your tuition paid. Basically, what it is like it's basically if they do so many years of the scholarship for you, you owe that plus an additional year. So if I could have done it the other way around to just do dental school, that would have been more ideal because your dental school tuition is way more significant than undergrad, at least for me anyway, because I did 2 private schools. So I think, doing HBSP is a great thing to do for those that are interested in doing that.
So, I guess looking back to even when you were picking an undergrad, at that point, did you know you wanted to go to dental school or no?
No.
Okay.
So my high school, we'll go back to high school. In Dallas, I went to the high school for health professions. I knew I wanted to do something in medical. I wasn't sure. Actually, the majority of my life, I actually thought I was going to be an OBGYN because, I always love babies and things like that. You're like, oh, they're so cute. But the one thing I would say about my high school is that I was able to, work in a gynecology clinic during my senior year as an intern. And so, I was actually able to go in there with them and do pap smears and take vitals and things like that. And so I'm like, man, women have a lot of issues. I don't know if I thought it was just about babies, but, being in the gynecology side of things, you see like vaginal abscesses and stuff like that. And for me, my 17-year-old mind, I'm like, ew, that is gross. I couldn't imagine myself doing that. Now I'm popping abscesses in the mouth. But that's how I was, at that time. So that kind of deterred me from wanting to do that. But I knew I still wanted to do something in healthcare. Went to Xavier, which is number 1 in placing African Americans into medical school. So I felt like, that was the situation that would best suit me. And especially they would expose me to different fields. So I was able to volunteer in hospitals. I was actually able to shadow some dentists at the time. That's what, I was talking to my counselor. She was like, well, have you ever thought about dental school? I'm like, no, not really. So she was like, well, why don't you shadow a dentist? I think one summer when I was home, I was able to shadow a doctor. Her name was Dr. Diane Earl. She was at Monarch at the time. I think she was like one of the first Monarch offices in Dallas at the time. So I was able to shadow her. I was like, oh, okay, this is pretty cool. And just talking to different dentists, just learning about, what they do and, their work-life balance. And that seemed like something that I was interested in. So, in my head, I said, okay, I'm going to apply to dental school. I'm going to apply to dental school. And then I was able to join MAPS. I've forgotten what MAPS stand for. But anyway, it's like a minority something to help. I can't remember what it stands for anymore, but I remember that being the acronym for the group. And I was able to shadow an oral surgeon in New Orleans. And so I was like, man, this is really cool what he's doing. So I said, man, if I do go to dental school, if I get in, I think I'm going to be an oral surgeon. So, this is what you're saying in your head. I'm just kind of going back, to that time. And then going to dental school and finishing dental school up. And you're just like, man, this is really cool what they do. But by the time that you become like a senior, you're like, man, I'm kind of burned out. I don't think I even want to continue on. I don't want to continue on with this. I think I'm just going to be a general dentist and call it a day. But it's kind of crazy, how things change in your life. So when I was able to when I became active duty, and my life was so much different, and I was able to kind of see things a little bit differently, I was like, you know what? And being able to, it's kind of like, you're kind of placed in various situations, and you're placed in different things. I would have never known that I would have gone overseas and been able to go to the operating room and, being able to do straight oral surgery. I knew I had an interest in it, but I never thought I would actually apply to the residency. So, being placed there, I think that kind of allowed me that opportunity to really see my purpose in life and what I'm really supposed to be doing. So looking back in retrospect, I guess I was always meant to do this. So here I am today.
It's cool how everything does kind of slowly start to piece together when you look back. You're like, oh, that put that thought in my mind the first time. It must have been like my initial interest or something. It's all very interesting. Yeah. So a couple more questions about your experience with the Air Force. Could you give us like your favorite thing about the experience and maybe something that you disliked about the experience?
I definitely loved being able to do things that I probably would not have been able to do on my own. That's the thing about being in the military. They kind of have their own rules about certain things. Like even, like they have prophy techs there. Like even the techs are able to do like prophies. And, these are like their assistants because they have so many active duty members that we have to service and make sure that they're deployable. So it's not that many hygienists that are there. So they're able to do different things. But, because like I said, I was able to go to the operating room. Like what dentist that anywhere is able to go to the operating room and work on a mandible fracture or do an orthodontic case? That's kind of unheard of. So, it really opened a lot of doors for me. And plus, also having the scholarships, that was advantageous as far as, lowering my student loan debt. So those are definitely pluses for me. I would say a con is, not being able to have control over, where you live. So, that can be a pro or a con based on, your personality. Some people like to travel and go different places. But I personally, I would rather be in one place. So, to me, that is a con.
Mm-hmm. So that's definitely good things for people to consider if they're thinking about getting
right. Some people like living different places. I would have never been able to live overseas, anywhere else. So, being stationed there, it's even cheaper to travel. So I did a lot of traveling there. I was single at the time. So, I went to Paris twice, went to Morocco. I've been in Edinburgh. I've been so many different places. Because you're in Europe. So it's just easier to travel. And plus it's more inexpensive as well.
Yeah, those are definitely really cool things to consider and great life experiences for sure.
Yes.
And now you're all settled down, so you can look back with fond memories.
Mm-hmm.
So for your OMFS residency, you chose to go to residency at Mayhera, you mentioned, and not do one of the military residencies. Can you talk a little bit about being a competitive applicant for residency? We got some questions from listeners about that.
So things have changed since I did my residency. I was probably one of the last classes that had we had scores for our boards, our part 1 and part 2. So we had scores for boards. I didn't have to take the CBSC exam, which is the medical exam that you have to take now. So now things have changed. You have to have a really good CBSC score. It used to be like when they first started doing that exam, like in the 70s, but now it's highly encouraging. This is what I hear from program directors. They want you to have like in the 80s score like that, because so many dental schools, like I said, not only are they not they're not doing board scores anymore. It's just pass fail. But some people aren't even ranking students anymore. So, that kind of, it's kind of hard to determine who will be able to handle OMFS. It's a very different ballgame. It's like, because I was a general dentist before, it's nothing like general dentistry. You just throw almost all of that out the window. Besides, extractions and implants, everything else is maxillofacial. So, we do internal medicine, we do anesthesia, we have to rotate in ICU. And then, like I said, the different things that we do, trauma, orthognathics, cosmetics. So it's just so many different things that are involved. And then now you can do either a 4-year or a 6-year program. The 6-year program is also obtaining your medical degree. So that you do 2 years of medical school. So that test is basically designed to basically say that, okay, I have a little bit of knowledge about the medical side of things. I know how, the body operates. So now that I go into oral surgery, OMFS residency, I can kind of focus, on OMFS. I'm not going to be an intern thrown into internal medicine and not know what the heck is going on. And so that's what you don't want. So it's kind of like a weeding out, to be honest.
So I guess one more question about your residency. So you mentioned now there's 4 and 6-year programs. How long was your program?
Yes, I did a 4-year program.
Okay.
So I actually only applied to 4-year programs. I did not even apply to any 6-year programs. Let's say, I think probably if I would have done residency straight out of school, maybe I would have applied for a 6-year program. But when I went back to residency, I was 30. So, when you get a little bit older, you're like, okay, man, when am I going to have kids? When am I going to do this? Not saying it can't be done. But, your perspectives about life are a little bit different. And I know for me, I'm thinking in my head, oh, shoot. When I graduate from residency, I'm going to be 34. What am I going to do? Like my clock is ticking. So that was just for me. And I think, as a woman, it becomes a little bit different, because especially when you're a female surgeon, you're a wife, you're a mother, you have other things to consider and to think about, as opposed to our male colleagues. They can do whatever all day. But even for me, when I go home or when I'm with my daughter, she don't want to be with her mama. So for the most part. So, those are things that you have to think about when you are thinking about residencies and what are you going to do. But regardless, I think it becomes, you have to think about what type of support system that you have. That is so important, having a great support system. Even in residency, I mean, some women do have babies, especially I know a lot of OBGYN colleagues that have had kids in residency. But it's always down to support and if you're on call or something like that, because you're going to get called at 2 or 3 o'clock in the morning. You can't just leave your baby there. So you have to figure out, what you're going to do, or if you're going to have someone come stay with you or something during that time frame, especially if you're single. I couldn't even imagine it. I couldn't even imagine being a single mom in residency, because it's so hard in itself. So, you just have to think about those little things that are really not so little, but they're really big things. And then someone that you can trust, with your kids. You can't just leave your kids with anybody. So those are all things to consider with your residency. But a lot of people ask, well, what's the difference between a 4-year and a 6-year program? So 4-year versus 6-year, as far as the scope of what you do is the same. Now, with that being said, like I said, the 6-year program, you get your medical degree with that. Now, where that becomes advantageous is depending on what you want to do afterwards. Some people want to do a fellowship, like let's say they want to do a head and neck fellowship, where they're head and neck surgeon afterwards. They might have to do an additional 2 or 3 years for their fellowship. So credentialing wise, for hospital privileges and for what they're able to get your privileges for, having that MD is an advantage because it's easier to get your privileges hospital wise for those things. Now, or some people I know have gone on even to full body cosmetics because you have to have your medical degree, because that's going to, some certain procedures are going to go under your medical license. So let's say, if they decide they want to go and do full body cosmetics and are doing like breast implants or Brazilian butt lifts or whatever the new cosmetics procedure that is out there, they're doing those things. And they're being trained for those procedures and credentialed appropriately for those.
That's very interesting. I didn't even think about oral surgeons leaving the oral maxillofacial area.
It's not uncommon, believe it or not. So they've had to change up some things, the way that we're trained, because I was told that people that trained prior to me, like let's say after they did, some people were doing like getting their medical degree because they would do MD first, like right after dental school, they would do their 2 years first and quit oral surgery residency so they don't do the oral surgery and go on to do something else. So they had to change how we are trained. So they might not get that MD, or you can't do anything with it. I don't know how they do it necessarily, but they definitely made some changes for that, because I've heard a lot of stories about those types of things happening.
That's very interesting. So something you were touching on before, I also wanted to ask about. I know that OMFS is like a predominantly white male field, even though it's progressively getting slowly better. But do you have any advice for someone that maybe is making them skeptical or afraid to go into the field?
I think, one thing is you have to have very thick skin, with this field, period. You have to know that you're going to have to read a lot. You're not going to get much rest. Rarely. But one thing that I will say is that knowledge can never be taken away from you. So if you prove yourself and if you read and your answers, one thing about OMFS residency is that, I don't know if you've ever heard the term of pimping. So we say this, and I think it's any surgical residency, to be honest. So pimping is a term where when you're on rounds or when you're rounding with patients, meaning like you're seeing all of your different patients that you have, that might be in-house for the hospital. They're still in the hospital on your service. Or they might be scheduled for surgery today, or, they're post-op from surgery or something like that. But anyway, we round on patients in the morning. So it's very early. And so that's when you walk around with your attendings and you go to each of your different rooms. You might talk about the patient, especially if you're the intern. It's like the lowest to the highest, the intern to the chief, depending on your team. So you go around and you're attending, or even your chief resident might pimp you, meaning ask you various questions related to your patient or what you're doing, or, their labs or whatever is going on with them. Or sometimes it might not even be, it might be random stuff that they might come up with. Then the reason why I say that is, if you read about your patient, the thing that I would say, know your patient, know what they're there for, know what they're getting done, know the procedure that you are doing or planning on doing. Just read about that, because if they ask you these questions that are related to what you're doing, you can't say you want to go cut a case and you know nothing about it. So essentially, that's what you have to do. You have to read a lot and know about the procedure, know about your patient, know about any kind of medical conditions that are related to your patient, know about possible outcomes that can happen surgically, or any or anesthesia wise. So reading is what I would say to definitely be good at. Because like I said, at the end of the day, they can't take your knowledge from you. They can say whatever they want to say about you. You got to remember that as a female, the goal, especially from your male counterparts, is going to be to try to make you cry. Unfortunately, that I've heard that several times. But you have to have very thick skin. You have to be very confident in what you're doing. And you got to realize that the reason why you got there, you're there for a reason. And I honestly, your grades or your scores were probably higher than theirs to begin with. So those are things that you have to think about, and you just realize that you have to be better.
Oh, that's great. So I guess moving on to kind of where you are now in your life. So you're obviously working at your private practice that you mentioned, and I know you also have like a scrub brand that you're working on,
Mhm.
and you are on social media and everything, and you have your family. So how do you attempt to maintain a balance? How is your week split up and everything? How are you managing it all?
I don't know. I don't know. Let me think. I mean, I think that having help helps a lot. My husband helps a whole bunch. We work together. So that's in its own is something that's very different from others. Um, Starting a practice, I knew nothing about business. Okay. I'm just going to be honest. You don't learn that in dental school. You're in school now. You don't learn that. Um, but for my husband, he has a business background. He's a business major, business and marketing major. That's what he knew. That's what he does. He has businesses. So it only made sense for us to partner together, for him to handle the administrative side of things and me to handle the clinical side of things. So that helps significantly. Whereas, some people, they go into these businesses knowing that they've never owned a business or know nothing about it, and they're going to struggle or they're going to fail because they don't know anything, and nor they're trying to learn anything. So it's great to be able to have someone that you can trust, that knows the financial aspect of things, and most importantly, not going to embezzle you, because a lot of doctors, my husband always says, is that we become lazy. We just want to show up, go to, do whatever we have to do and leave. But in business, you really can't do that. You have to stay up on your finances, and you have to have a team, first of all. So, my team is, of course, my husband, my family, but also, you have to have an accountant or attorneys and all of these things. So to help you with that balance. And I think one thing about it is, for me, is to learn how to let things go, or try not to have too much on your plate, or, try not to be too cheap about certain things. Sometimes you have to pay someone to do something that you just don't have the time to do anymore. So that becomes a problem. So as far as, my scrubs are concerned, I devote certain days for that. For example, I'm off on Tuesdays, so I try to do things like what I'm doing with you on Tuesdays, or try to make, doctor's appointments on Tuesdays, or, just different little things, or try to catch up on these days, especially because we have a new practice. We're not like super majorly busy where we can't get patients in the door, or because we're having them back like 3 months out. So we're able to kind of balance that through the other days. So that helps quite a bit to have that admin day to kind of circle back and regroup and or catch up.
And are you the only surgeon at your practice right now?
Yes. Mm-hmm.
Okay. Do you plan to stay that way, or is there
I
a
don't
goal
know.
to
So
expand?
so I always planned on expanding. I really, really want to. I don't know when that will be. And honestly, I have a great interest in cosmetics. So I love doing the cosmetic aspect of things. In my mind, when I opened up the practice, it's called About Face. The reason why it's called About Face is, number one, I was prior military, I'm a military veteran. So About Face is a term that we use to turn around. That's simply what it means. So my thoughts on our practice is that we're transforming lives, we're transitioning things, we're turning things around. So that's why we're called About Face. Um, in my mind, in the future, I would like to have an associate that's doing more of the oral surgery procedures, and I'm focusing more on the facial cosmetic procedures. So that's definitely what I would like to do in our future. So expanding, definitely. I just don't know when, but that's in the back of my head.
Yeah, that's awesome. That's super exciting. And it's great. You do, I think, when you're starting a practice, you need to have the vision, the goals, but also, like you said, being realistic and understanding because you've been open for a few years now. And like you said, you're growing over time. You're still a newer
Yeah.
practice. So it's good
Hmm.
to be aware, but also ambitious. So that's awesome.
Yeah.
Someone did ask a couple more questions about your practice. They were wondering how you develop like a strong team with your other employees. What are some things that you do to make things run efficiently?
Systems. Systems in place. I think that's the one thing that I did learn because I said I previously worked with corporate. So those are things that I did learn. Having, your documentations in place. We take pictures of our setups, just pictures and you write down list of I'm trying to get my list of outlines of activities or their job descriptions or things like that. So that helps a lot. So let's say if you do get a new assistant or something, they're not trying to figure out what they need for, your implant setup because it's all in a binder. It all has a picture laid out right there of exactly how it should be set up and what you need and what I want, for my setup because every doctor is different. So that helps a lot with transitioning and keeping your staff aware of what's going on.
That makes a lot of sense. I assumed it was something like that. I've heard from the most successful practices, they have a very clear way that they like things done. And they have, like
Mhm.
you said, those binders, those almost like manuals that make
Mhm.
sure everyone's on the same page. So that's awesome.
Yep. Mhm.
That's pretty much everything I wanted to talk about today. I know we covered a lot, but do you have any closing thoughts or final advice you want to give out to dental students listening?
Okay. I would say that whatever you want to do, even if it's not OMFS, just think that you can do it. Figure out what you need to do to apply for that position. Have confidence in yourself. And have realistic expectations or goals about what you want to accomplish as well. If you know you don't want to work hard, don't apply to oral surgery. Because we work hard and we don't get a whole bunch of sleep. But I think at the end of the day, it's well worth it. It's a very lucrative field. And I think that, we have so many different things that we do. You're never going to get bored in this field. So you can do it. Just decide, get a mentor, talk to, oh, one thing I will say as far as the students that are interested in applying, do as many externships as you can, especially if you want to apply straight out after school. You can go to ADIA. I think ADIA has different residencies in the different specialties, and this can go to any specialty. Do externships. And then that way you can kind of get an idea of the culture of the program where you're trying to apply. You can get an idea, talk to the residents or even who will be the incoming chief during the year that you're going to be applying and keep their contact information. Do well, on your CBSC, I think, or if you're doing ortho, I think you have to take the GRE. I don't know if they're still doing that, but try to do well on those exams because those are the things that they're looking at. But I think the externships and building relationships with your co-residents or future co-residents, that's probably the most important. And of course, getting great recommendations. Don't, if you know that this person does not know you very well, don't ask them for a letter of recommendation, okay? Because you want to get a good letter saying that, I know this person, I know that they're capable of doing it. You don't want to get a letter that's saying, hey, Portia James is interested in applying to this residency program, and she was a good student, period, or something like that. You want a good letter of recommendation saying that this person is vouching for you. They know that you're going to do well. They know that you're going to succeed. But most importantly, they know that you're going to be able to complete the program because no one wants anyone that's going to be in the program and decide after internship that they can't handle it.
Thank you. That was a lot of excellent advice. I do really appreciate it. And everything today, I really do appreciate your time. Finally, I guess, is there a good way for people to get in touch with you, or where should they follow you if they have any
Yeah.
questions?
Sure. You can find me on social media at Dr. Porchia. That's DrPorchia. And you can go to our website aboutfacesurgery.com or email me at drjames, DrJames, at aboutfacesurgery.com.
Awesome. Well, thank you so much for your time. I really appreciate it.
Okay, thank you so much. Have a great one.
Thank you, too. Alrighty, that is the end of this week's episode of the Dental Download podcast. Look forward to another episode on Monday, as always, with a different guest next week. Next week is going to be Dr. Paul Goodman of Dental Nachos. We talk about how he started Dental Nachos and how he manages 3 dental practices, 2 little children, and this other business. And I just think he has a lot of great insight. His job through Dental Nachos is talking to dentists, building dentist community, continuing education courses. So he's a really great speaker, and he has a lot to share when it comes to insight and wisdom and guidance for dental students specifically, since I know that's most of my audience. So I hope we're all looking forward to that episode next week, and I will talk to you next Monday.